And hello everyone, and welcome back to the channel. Today, we're diving into a topic that many of you have asked about, the antibiotic azithromycin. You might know it by brand names like Zithromax or Zip-Pak. It's one of the most commonly prescribed antibiotics out there. So let's unpack what it is, how it works, and what you need to know to use it safely and effectively. First off, what exactly is azithromycin? It belongs to a class of antibiotics called macrolides. Think of these as the precision specialists of the antibiotic world. Their primary job is to stop bacteria from growing and multiplying. They do this by targeting the bacteria's ribosomes, which are like tiny factories that produce essential proteins. By shutting down these protein factories, azithromycin effectively halts the bacterial invasion, giving your immune system the upper hand to clear out the infection. So, when would a doctor prescribe azithromycin? It's a go-to for a variety of common bacterial infections. We're talking about things like certain types of pneumonia, bronchitis, sinus infections, and ear infections. It's also used for some skin infections and certain sexually transmitted infections. What makes it so popular with doctors and patients is its convenient dosing schedule. Often, it's just one pill a day for 3 to 5 days. This is because azithromycin is quite clever, stays in your body's tissues for a long time, continuing to fight off bacteria even after you've finished your last pill. Now, let's get into the nitty-gritty of how to take it correctly. Following your doctor's and pharmacist's instructions is absolutely crucial. Usually, you'll take it once a day, with or without food. However, some formulations, especially the liquid suspension, might be better absorbed with food to minimize stomach upset. The golden rule is consistency. Try to take your dose at the same time each day to maintain a steady level of the medicine in your system. This helps it work most effectively. One of the most important things to remember with any antibiotic, including azithromycin, is to complete the entire course. I know it can be tempting to stop once you start feeling better, but please don't. The infection might seem gone, but some tougher bacteria could still be lingering. If you stop early, these survivors can multiply, and the infection could come roaring back, potentially even stronger and more resistant to the antibiotic. Completing the full course ensures you've wiped out the infection completely. Like all medications, azithromycin can have side effects. Most are mild and manageable. The most common ones involve the digestive system, things like nausea, diarrhea, vomiting, or stomach pain. Taking the medicine with a small meal or snack can often help reduce this discomfort. If these symptoms are severe or don't go away, it's important to talk to your doctor. While rare, there are more serious side effects to be aware of. Allergic reactions can happen, with symptoms like a rash, hives, itching, or swelling of the face, lips, or tongue. In very rare cases, a severe allergic reaction called anaphylaxis can occur, which is a medical emergency. Azithromycin can also, in rare instances, affect your heart rhythm, particularly if you have a pre-existing heart condition or are taking other medications that affect the heart. It's also been linked to liver problems in rare cases. If you notice symptoms like yellowing of the skin or eyes, dark urine, or severe stomach pain, contact your doctor immediately. This all sounds a bit scary, but remember, these serious side effects are not common. The key is to be informed and know what to look for. It's also vital to tell your doctor about all other medications you're taking. This includes prescription drugs, over-the-counter medicines, vitamins, and herbal supplements. Why? Because azithromycin can interact with other substances. For example, anticides that contain aluminum or magnesium can reduce its absorption, so you should take them at least 2 hours apart. It can also interact with blood thinners, certain heart medications, and others. Your doctor and pharmacist need the full picture to ensure your treatment is safe. Now, let's talk about something really important: antibiotic resistance. This is a huge global health issue. Antibiotics are powerful tools, but they only work against bacteria. They do absolutely nothing for viral infections like the common cold, the flu, or most sore throats. Using antibiotics when they are UNT needed contributes to the rise of superbugs, bacteria that have evolved to resist our best medicines. So, never pressure your doctor for an antibiotic if they say it's not necessary. Trust their professional judgment. Taking azithromycin for a virus won't help you get better and can contribute to this larger problem. To recap, the key takeaways for using azithromycin safely. Always take it exactly as prescribed by your healthcare provider. Complete the full course even if you start feeling better. Be aware of potential side effects, both common and rare, and know when to seek medical advice. And finally, remember that antibiotics are for bacterial infections only. Using them wisely helps ensure they'll still be effective for us and for future generations. Your health is a partnership between you and your healthcare team, and being an informed, active participant is the best way to ensure a great outcome. I hope this overview has been helpful and cleared up any questions you might have had about this. Remember, this video is for informational purposes only and should never replace advice from your doctor or pharmacist. They know your personal health history and can give you the best guidance. Thank you so much for tuning in today. If you found this information valuable, please give this video a thumbs up. And do UNT forget to subscribe and hit that notification bell so you won't miss our future content. Stay safe, stay informed, and we'll see you in the next video.